Good afternoon. Thank you for joining us. I'm Maria from UHS Events team, and we're excited you're here. Before we begin, a few housekeeping items. We're recording this session, so if you don't want to be recorded, your voice or video, please turn that off. If you're not following us on Instagram, follow us at CPP_UHS Events. It's also listed in our chat. As we said, we will be uploading this to YouTube, so if you're not subscribed, subscribe at UHS Events Team CPP. For attendance, make sure that you put that into the chat. And also, if you have any questions for Dr. Amy Dow, our guest today, please put that in the chat. You can either direct message me or you can put that in with everyone. She will be joining us at the end of the presentation to answer your questions. So if you can't stay, just look at it later on our YouTube channel. So a little bit more about Amy. So she is our faculty in residence here at Cal Poly. She's lived within Palm Dritos community and then also within Sequoia. So she wanted me to give a shout out to that. She's been working here for 2 years and she is an anthropologist. So we're going to hear more about her perspective on COVID-19 and there will be a brief introduction in her presentation. So without further ado, I'm going to pull up her presentation and share that with you all so we can get started. Perfect. And let me know if y'all can hear this.
What kinds of questions and topics an anthropologist might explore while investigating COVID-19. First, a little bit about me. I received my PhD in socio-medical sciences and anthropology at Columbia University. I also did my master's there. And basically, socio-medical sciences is kind of a fancy term for public health or a social science perspective to public health. I also received my bachelor's in anthropology at UC Riverside, which is not too far from here. And for my PhD research, I lived in Vietnam for over 2 years, studying how people made decisions about health insurance during the country's campaign for universal health coverage. If you're interested in any of these topics or anything you hear about today, you can follow me on Twitter. My handle is @AmyDow. So our agenda for today. First, I'm going to talk about what is anthropology. We're going to define what it means to be healthy. Then I'm going to talk about medical anthropology itself. We're going to look at the role of culture in health and healing. And then we're going to talk about 3 approaches to health using an anthropological perspective. Then we're going to use these 3 approaches and apply them to how we might think about COVID-19. So first, what is anthropology? Well, anthropology is the study of human culture from the past to the present. In the US, we actually have 4 fields in American anthropology. First, we have archaeology, which studies the history of human beings through artifacts which are excavated at archaeological sites. I'm going to use sort of these pop culture references to help you think about the different kinds of anthropologists in the US. So, of course, for archaeology, we have Indiana Jones, who sort of made archaeology famous. Next, we have cultural anthropology, and this is how I identify. Cultural anthropologists study beliefs, behaviors, communities, and institutions of human beings. We look at how people make meaning as they live, work, and play together. Cultural anthropologists live in the communities that they're studying in order to get an insider's perspective of what is going on. And for our film example, we have Avatar, which features a cultural anthropologist who goes to live with the aliens that they have encountered in order to learn their ways. Next, we have physical or biological anthropology, which investigates humans from a biological perspective. A famous biological anthropologist is a forensic anthropologist from the TV show Bones. And then lastly, we have linguistic anthropology, which studies human language, including language used in the past and the present. And a famous example a famous pop culture example is Amy Adams's character in Arrival, who studies the language of the aliens who have arrived on Earth and learns to think the way they do as she starts to learn the language. So these are just the examples of what anthropologists do and how you can kind of define anthropology. And we're going to look specifically at cultural anthropology for today, since we're looking at meaning and how people make meaning. So, speaking of meaning, what do we mean when we say the word health? So, in the West, or in the US and European countries, we are conditioned to think about health strictly as a biological topic and not really a cultural topic. However, I want you to stop and consider, what do we mean by the word healthy? And how do we achieve health? So, the World Health Organization identifies health not simply as the lack of disease or infirmity, but also the attainment of physical, mental, and social well-being. So think about it. Would you be healthy if you never interacted with other people? Something that we've all been thinking about lately, right? Would you be healthy if you were put in solitary confinement? Could you be truly healthy in these instances? Because this definition emphasizes our social well-being, we know that social well-being is very much a real part of having a healthy life for human beings. Yet, social well-being is not necessarily a biological topic. Instead, it's a cultural topic. So, medical anthropology then. It's a field in cultural anthropology which studies health and illness across human cultures. So the term medical here doesn't refer to Western medicine, but it includes all the practices that address any and all kinds of affliction, pain, or suffering. It's been a growing field since the 1980s, and medical anthropologists make use of the anthropologist toolkit of fieldwork and participant observation to explore the relationship between health and culture. In particular, medical anthropologists often focus on, one, the interaction between disease, environment, and human culture. Two, how human cultures understand, experience, and react to illness. And also, how systems of health and illness interact with cultural sources of power and inequality. So, let's talk about the role of culture in healing. So we often think of healing primarily as a biological process. You take pills or get treated for an illness, or you don't get treated and either it will resolve itself, or you live in pain, or you might even die from your illness. Now we're beginning to see more attention paid to the influence of stress and the psychological components of health and illness, which is good, but for today, I want to argue that culture plays a significant role in giving meaning to the biological processes of illness and healing. So it organizes those events that we see as valuable or stressful, or the kinds of treatments that we think will work. So here's an example. The first example I want to talk about is the dip-peak effect with the Chinese harvest moon and the Jewish Passover. So researchers found that the death rate drops by about 35% right before the Chinese Harvest Moon Festival, and then peaks right back up again to about 35% the week after the Harvest Moon Festival. So there's something going on here where death rates are falling because there is some kind of meaning that's put to an event, a life event, right? That they want to live through. And then after that event passes, then they pass over to the other side. The next example I want to talk about is Chinese astrology and its influence on birth years. So since the 1970s, this Chinese zodiac has affected the national birth rates in Asia. Lots of people still prefer dragons over every other sign. So in 2011 and 2012, prospective parents in Hong Kong, Taiwan, and Singapore admitted to consciously timing their pregnancy for a dragon year. Their efforts and the efforts of previous generations are reflected in the country's national statistics. So whenever a year of the dragon comes around, the national total fertility rate, which is the average number of children born per woman, tends to spike. In Taiwan, also, the year of the tiger is often stigmatized, so there's even a reliable dip in the per capita births during the year of the tiger. So this shows us how there's cultural meaning associated with these events that influence the biological experience of birth, and then even the biological experience of death, if you're thinking about the dip-peak event. But this doesn't just happen in other societies or other peoples. We here in the US also have these sort of cultural meanings that are associated with certain things. So, for example, there was a study done on medical students regarding red and blue pills. So red often symbolizes a stimulant, meaning that it's up or hot or danger, while blue is a color that's usually associated with a depressant, which means down, cool, or quiet. And the more pills the student takes, the more effect that it has, or the intensifying effect, that it took more intensifying effect. So here, these pills were actually all placebos, but they were told that these colors meant, these colors had specific meaning to the pills. And so when students were given these pills, they were told that they would receive a pill with either a sedating or a stimulating effect. Students who took the blue pill, which was a placebo, were convinced that it had sedating effects, while those who took the red pill, which was also a placebo, were convinced that it had stimulating effects. Because we associate culturally blue with calmness and red with stimulation, these cultural factors affected the outcome of the experiment. So these students actually reported that they felt that, or the ones who took the red pill felt that they had more energy, more focus, whereas the ones who took the blue pill reported that they felt more calm, more relaxed. And so typically, we call this the placebo effect, right? We write it off as purely psychological and not connected to any kind of medical efficacy. And it's easy to overlook the significance of cultural meaning in a way that influences the way that people experience their biology. But placebo effects actually differ cross-culturally. So a medical anthropologist did a comparison of placebo effects for ulcers, where he compared 117 double-blind random control trials that spanned several countries, including Germany, Brazil, and Denmark. He found that the placebo effect was different in each country, with Germans experiencing the most healing of an ulcer, from a placebo, and Brazilians experiencing the least rate of healing from a placebo. So something else is going on here that's not just purely biological. But to say, though, that the placebo effect is patterned cross-culturally, that it's different across cultures, should really make us stop and take notice of the importance of culture in the healing process, instead of just writing it off as a placebo effect, as if it was just some random occurrence. So, to say that culture is that important in a biological process can be unsettling to us, because it doesn't fit into our assumption that disease is only a biological process. It crosses boundaries, right, between biology and culture, and so it's called a placebo. But in fact, there is something cultural about the way we are experiencing disease, death, and illness, things that we often assume to only be biological. So why do we get sick? Again, we're going to look at the role of culture in sickness. So I want to start off with, so we're going to look at a biomedical perspective and a cultural perspective. And we're going to look at an example. So this was a famous incident that was recorded at a Western teaching hospital. The teacher presented a case to her students about a woman who was suffering from chronic and debilitating headaches. When the patient was asked about her headaches, she responded with personal details. So she recounted how her alcoholic husband would beat her, how she was stuck in a house almost every day caring for her ailing mother-in-law, and how she worried about her teenage son who was failing out of high school. One of the medical students then raised their hand and asked, "But what's the real cause of her headache?" And so this question by the student demonstrates something. So this student was only focused on what he saw as a biomedical reality, i.e., he wanted to know the neurochemical process that created the pain in the patient's head, right? But he completely skipped over and skipped past the culturally based stress factors in the woman's life. So here we have two sort of conflicting ideas, right? The biomedical perspective, which is solely focused on sort of the neurochemical processes, and then the cultural perspective, which is actually looking at the whole human being and how their experience of their life is actually affecting their health and affecting their biology. So, given that culture has a role in the way that we experience illness and disease, I want to talk about 3 approaches to studying health that we use in medical anthropology. So the first is the biocultural or ecological approach, which examines how health and healing are shaped by biological, environmental, and cultural processes. So take out the word both there, sorry. Next is the political economy of health perspective, which is an approach to the study of health and illness that analyzes the impact of inequality on people's health status, their access to health care, and their health outcomes. Lastly, we have the interpretive perspective, which approaches health and illness and analyzes healthcare as a system of meaning. So how society's understandings of and responses to disease are shaped by the cultural meanings given to that affliction. So think again about the dip peak experience. Think again about the woman who was experiencing really debilitating headaches that she felt were caused by the stress of being at home, being experiencing intimate partner violence, and worrying about her son's future. Okay, so these are the 3 perspectives. And so how can we use these 3 perspectives to think through coronavirus and what we've been seeing with COVID-19 in the news and in the news. So first, the biocultural or ecological perspective. So someone, an anthropologist who takes this perspective, might approach this issue of coronavirus by looking at the risk factors for experiencing the disease more severely. So those who then become hospitalized or more at risk of dying from COVID-19, what are those risk factors and how are those risk factors created through the relationship between the virus itself, people's biological predisposition that's created by the interaction between their environment and culture. So here's an example. If we're looking at risk factors that are shown from the website of the CDC, the Center for Disease Control and Prevention, we see that they list out people who are at higher risk for severe illness. So based on sort of the information that we've seen, those that are at higher risk of severe illness from COVID-19 are the elderly, people aged 65 years or older, people living in nursing homes, and then for people of all ages, some of the pre-existing conditions that make you at higher risk for experiencing COVID-19 more severely are having chronic lung disease or moderate severe asthma, those with serious heart conditions, people who are immunocompromised, people with severe obesity, people with diabetes, with chronic kidney disease, and also people with liver disease. So a medical anthropologist who might be taking a biocultural perspective might ask some of these questions while looking at these risk factors. So they might look at the example of people with asthma or severe lung disease and see what kind of environment they are living in that make them more exposed to pollutants that might cause this disease. For example, depending on where you live in Southern California, you might have higher rates of asthma. Certain communities experience higher rates of asthma because of how smog is created in the western part of Los Angeles, and then moves through the air and gets trapped by the San Bernardino Mountains and sort of hovers over Riverside County. So that's sort of an environmental risk that makes people more exposed and creates a higher prevalence and incidence of asthma in particularly Riverside County. And as you know, one risk factor for experiencing COVID-19 more severely is asthma or having some kind of chronic lung illness. Another example, so if we were to look at the risk factor of obesity, medical anthropologists using a biocultural perspective might look at what kind of neighborhood you live in that might predispose you to obesity. So for example, if a person lives in a place such as a food desert where they don't have high quality groceries, they may not have access to fresh foods or high quality foods that help you eat healthier. And so they may only have access to fast food, which then is also a risk factor for obesity. Again, the biocultural perspective looks at the interplay of biology, environment, and culture. Next is the political economy of health perspective. Again, this one looks at the impact of inequality on people's health status, access to care, and health outcomes. In other words, here we're looking at health disparities. So a medical anthropologist using a political economy of health perspective may look at the data coming out of COVID-19 hospitalizations and death to find out that there is a definite pattern to who lives and who dies from the disease. So it's not just about the biology of the virus and its interactions with our bodies, but social inequalities also make people more at risk for experiencing COVID-19 more severely. So here's an example taken from the census, from Statistica. We have found that African Americans are disproportionately dying because of COVID-19. Here in this chart, it shows that even though African Americans, for example, in Louisiana, make up only 32% of the overall population, 70% of the deaths in Louisiana from COVID-19 are actually African Americans. So they are overburdened with death rate, the African Americans are showing up more in the counts of death and their share of death from COVID-19. Likewise, if you go down the list, you see that even though the population of African Americans is 42% in Illinois, or I'm sorry, 15% in Illinois, they make up 42% of their share of COVID deaths. So one particular huge health disparity or health outcome disparity is the city of Chicago. African Americans make up 30% of the population, but 69% of the deaths of COVID-19. Here's more data about the death rates between African Americans compared to white deaths. And here you can see a stark difference between who's actually dying from COVID-19. So in Louisiana, there are 27 deaths per 100,000 people amongst African Americans versus only 5.8 in deaths per 100,000 for white people who identify as white. If we move down to Michigan, we see 21.6 versus 2.6. Illinois, 7.2 compared to 1.3. So we see here this stark difference in terms of who is experiencing more deaths because of COVID-19. So most anthropologists and the vast majority of social scientists agree that it is racism rather than race itself that explains this inequality. So racism refers to both the thoughts and actions of individuals, as well as institutional patterns and policies that create or reproduce unequal access to power, privilege, and resources and opportunities based on imagined differences between people because of the color of their skin. So studies show that discrimination can get under the skin, quote unquote, and this has far-reaching consequences and biological effects, which include the onset of obesity. So here in this column written by a biological anthropologist, actually, he writes about how studies in the past have shown how discrimination is connected to the onset of obesity, of high blood pressure, how discrimination can lead to poor diabetes control, impaired immune function, and also accelerated cellular aging. Not only is it discrimination out in the world, people of color often experience discrimination in the healthcare setting, which compounds and makes the access to care even worse. So during this crisis, then, these inequities are likely to grow because the healthcare system is under increasing strain from all the cases that they're experiencing. And so this discrimination could have effects, and these effects are being shown in terms of who lives and who dies and the patterns that we see. So when we're talking about institutional racism, we're talking about the policies and practices that create and enforce racial inequities in major systems of society, such as our education system, our housing system, our legal system, and even in our health system. And many social scientists and researchers have shown how structural inequality is the source of racial health inequities and and those unequal health outcomes. So a medical anthropologist studying using a political economy of health perspective may look at these differences that you see and ask, how do we explain these inequities in COVID-19 deaths? And how can we look at the way we structure our economy, the way we think about race and racism, and how do these affect the ways that people are treated and who lives and who dies from COVID-19. Not only does a political economy of health perspective look at race, but this perspective also looks at inequality in terms of who we see the inequalities when it comes to who is suffering economically from COVID-19. So here's a chart showing which industry is at high risk for short-term layoffs because of the coronavirus outbreak. And you see that most of them, the 37 million or so jobs that are at risk, many of them are low-wage jobs. They're low-wage service jobs in food and drink, retail jobs, and travel. And in addition, for those working in the food and drink industry, these are also considered essential workers. So some of them are considered essential workers during this crisis. But unfortunately, it is essential workers who are reporting the most difficulty in affording basic household expenses as compared to non-essential workers. So the Kaiser Family Foundation, which is a nonpartisan research group, they did a study, a survey asking essential workers and non-essential workers about their ability to pay or ability to afford things, whether or not they have fallen behind on payments for any of the following things, and they compared essential workers versus non-essential workers. So as you can see, essential workers are having much more trouble paying credit card bills and other bills. They're having way more trouble paying utilities, rent, and food compared to non-essential workers. And so you see this huge difference, right? And when we're thinking about essential workers, we're thinking about those who have to work during this time and cannot work from home. Essential workers are also less likely to be able to afford a $500 medical bill as compared to essential workers, or sorry, non-essential workers. And so for this perspective, the political economy perspective, people who subscribe to this anthropological perspective will ask questions about why does COVID-19 hit people in different social, economic positions and also people of color differently? And what is the sort of source of this inequality? Lastly, we're going to talk about the interpretive perspective. And again, this is an approach that looks at healthcare as a system of meaning and what kinds of meanings we give to our illnesses and our afflictions. Here particularly, I'm going to look at the language used when discussing COVID-19 and the implications of language. And And also we're gonna look at metaphors for talking about COVID-19 and the social implications of using metaphors for thinking about COVID-19. So language has important consequences to the way that we think about and approach everything. Anthropologists agree that language really gives us a way for thinking about things in a certain way. It informs us what's possible. And so lately we've been seeing the phrase, and we've been using and seeing the phrase social distancing to describe what we're doing to keep each other safe. Many anthropologists and social scientists have criticized this phrase because it implies that we must be socially isolated, when in fact what we're really doing is just being physically distanced from each other. It's coming as a criticism because in fact right now a lot of research is showing that we're actually experiencing, or prior to COVID-19, we're actually in the middle of an epidemic of loneliness in society. So we actually need to increase our social connection, which we can still do at a physical distance. And so using the language of social distancing then really erases the social connections that keep us alive, well, and happy. And so as you can see from this news article, the WHO, the World Health Organization, because of these criticisms, is actually advising people to call what we're doing physical distancing rather than social distancing, because social connection is very important at this moment. Here's another way that language is influencing behavior in the world. People who have been calling coronavirus the Chinese virus are currently being criticized by social scientists because of the effects that it's having on increased violence and racial discrimination against Asian Americans. So a medical anthropologist studying this would look at these factors, so the use of this language and how they impact the experience of Asian Americans living in the US, as we have seen a spike in violence and racial discrimination. And so we want to move away from this language. Or a person who's using an interpretive perspective would analyze, what are the implications of using the word Chinese virus on people's behaviors, their beliefs, and what are the social implications of that. Another way an interpretive perspective could inform the study of COVID-19 is to look at metaphors used to discuss the disease. So many have pointed out the use of war metaphors and have argued that these kinds of expressions are actually problematic. So if we're thinking about this as a war, then using this kind of language and metaphor can legitimize certain behaviors, such as encouraging police or military violence to enforce physical distancing or justifying violence. This kind of war metaphor can also facilitate forms of surveillance by private industries or even the state under the guise that we need to relinquish many of our rights in the name of war, because that is what you do during a time of war, right? So moreover, it also takes away from the work of healthcare professionals who are actually, what they're doing is actually healing people and not, in fact, fighting a virus. So these kinds of metaphors really do matter because they influence the way that we think about things, which then influences the way that we behave. So anthropologists who take an interpretive perspective will look at these metaphors and the effects that these metaphors about COVID have on the ways that people think and behave. And for a critical perspective on the use of metaphor, I really like this comic, which shows which is by an artist named Eric Kostikiewicz Williams. And I really like this comic, which shows a group of guys who are discussing COVID-19. And so in the first panel, one of the guys says, "Bro, don't you feel like COVID is maybe Mother Nature's response to humankind's transgressions?" And then another guy opens the door and says, "No doubt." And then the guy walking in says, "Yeah, totally. The earth needs to heal. This could be our moment to press pause and then suddenly in the next panel, a spirit appears that slaps each of those guys in the face. And then another guy says, "Oh my God, is that?" And it turns out to be the ghost of Susan Sontag. And so for a little bit of context, Susan Sontag is an American writer and philosopher, and some of her most famous works dealt with the use of metaphors for illnesses. One of her famous books is Illness as a Metaphor, in which she critiques the use of metaphor for discussing cancer and HIV/AIDS. She argued in that book that oftentimes this type of language leads to victim blaming rather than helping those who are suffering from the disease. And so here in this comic, her ghost appears to make this argument again, but for COVID-19. So the guy says, "Is this the ghost of Susan Sontag?" "Why, yes," she says. And so he says, "I read you in school. What are you doing here?" And she says, "I've been awoken from my eternal slumber by the incessant noise surrounding the current health crisis." The guy says, "It's a lot, huh?" And she says, "Certainly is, but it's all too familiar. In my day, cancer was associated with depression and repressed passion, AIDS with promiscuity and moral failing." So here she is kind of rehashing the arguments that she made in her books, which are shown at the bottom there. And then she says, importantly, a conjured narrative, whether it romanticizes or demonizes, does no favors to those who are actually ill. Chalking COVID up to being Mother Nature's revenge reeks of classicist misanthropy and a disregard for human life. Labeling it a Chinese virus and pointing out the inherent racism and scapegoating feels a touch obvious, but sadly necessary. So she's critiquing this metaphor of talking about COVID-19 as Mother Nature's revenge, as showing a disregard for human life. And so she continues, "Nothing is more punitive than to give an illness a meaning, invariably a moralistic one. By all means, take moments to enjoy the pause on your routine if you have that luxury. Bake your sourdough," she says. In the next panel, she says, "But seek meaning in how we respond in supporting one another, and how we can improve the infrastructure of our society." And then it ends with her leaving, and he cries to her, "Where are you going? Don't leave. There's so many more people I want you to slap." Because, as we can see, all of these metaphors, right, have been appearing about COVID-19. This is all the interpretive perspective, right? And so sadly, she says, "Sadly, the rest is for you all to figure out. Besides," and then she jokes, "besides, salons are still open in the afterlife and I've got to get this bang highlight touched up." And then she leaves. So I like the way, so I think her critique really holds true still, and this is a perspective that an interpretive anthropologist might take on COVID-19. But I also like the way that Sontag concludes through the comic, in which she says that instead of trying to figure out how to explain the disease via metaphor or some meaning behind it, we should all be paying attention to what we are actually doing to help those who are suffering from COVID-19. So the people of color, people who are low income, low wage earners who are losing their jobs, or even essential workers who are not paid a living wage, but expected to put themselves at risk every day to deliver our food or make our food, for example, right? So what kind of meaning can we make out of that? And what is it that we can do given that COVID-19 has revealed our society's fault lines, has revealed the ways that our society has really failed people, the people who are suffering the most. And so I want to end then on this idea of mutual aid groups, right? So Susan Sontag's GHOST refers to, we should look at the meaning and how we respond in supporting one another and how we can use these kinds of responses to improve the infrastructure of our society. So something that's been going on all across the world, and especially in Southern California, is the organization of mutual aid groups. So mutual aid groups are community created and community run groups that help to support people who have been the most impacted by COVID-19. Some of the things that these groups have done are provide food and supply drop-offs, provided transportation, monetary assistance. Some are even helping people to navigate social services, and they're helping out groups that have been most impacted by COVID-19, which are working class people, poor people, people who are low income, undocumented, disabled, elderly, or immunocompromised. These are the groups that are facing the biggest challenges due to COVID-19. And so these mutual aid groups are filling in gaps where the state and the private sectors have failed. And so an anthropologist can study these community groups and use them as a model to think about how we can build a better society in a post-COVID-19 world. Thank you very much for tuning in. If you have any questions, go ahead and please leave them on the bottom in the little comment area, and I'll try to get back to you soon. If you're interested in all of this, please follow me at my Twitter handle. Thank you so much for your time.
All right, awesome. So that was amazing. I learned so much. And I know that Dr. Dow is going to be joining us. So if you do have questions, please make sure that you put them into the chat. Or you're free to ask now.
Is she here already? Is that?
Yes, hi, welcome.
Hi, I'm here.
Thanks for joining us today.
Yeah, of course. Thank you for giving me this opportunity to share some of these ideas with a broader audience.
Yeah, I have a question, Dr. Dow.
Yes.
Is it
Panda?
Yeah, I'm Panda, sorry. I actually work on the UHS events team. I'm the residence life intern. I had a question about, so your presentation was about how culture affects how we respond to, different illnesses and different things like that, and healing and community care. I just wanted your perspective because there's a lot going on the Navajo and Hopi reservations right now. They're like 11% of Arizona's population, but they're about 69% of the COVID cases, confirmed COVID cases. So it's like disproportionately affecting, folks on the reservation. They're not receiving any aid. They're supposed to receive, the reservations throughout the United States are supposed to receive about $8 billion in aid, but have not received that, and it's been halted. And even previously there was lack of resources especially on, the reservation, like Navajo reservation and Hopi reservations. What is your perspective on how issues with COVID-19 are actually affecting culture? Because I know a big thing here, with the Native community is, sure, a lot of younger folks are not being affected by COVID-19, which is almost a fallacy and a myth, because a lot of young people are dying as well. But the big push in the Native community is to protect our elders, right? Because a lot of the elders are a vulnerable population, and a lot of the elders are carriers of that culture, that we speak of, that, feeds into our ways of healing, feeds into our ways of community, and the way we view the world. And so what's your perspective on that?
Absolutely. And the statistics that you just cited about the Navajo reservation, I just saw articles written about that, I think this morning. And so I wish, I could have gone back in time and included that in the presentation itself. So thank you so much for bringing it up. Yes, I mean, Native American communities have been just historically marginalized, experienced a lot of violence in the US, and that is something that needs a lot of attention brought to it, especially because of the disproportionate amount that they're being affected, as you mentioned. I think that, this COVID-19, it's one of those situations that as we start to, as economies start to reopen and everything, we're all gonna have this shared experience globally, which is really something fascinating to just even imagine. And so we absolutely need everyone's stories, the elderly, elders in families, the ways that we actually cared for each other at this time, right? Because that's the way that I sort of wanted to end my presentation, was to think about, look at all the ways that society isn't working for so many people, right? And this is a moment where we can actually pause and reflect and think about what we can do, what stories we want to keep, what kind of language do we want to use to talk about rebuilding society so that it works for all of us, right? Or that it works for more of us than it has before. So I absolutely think that stories and the way that we talk about care at this time should definitely inform how we think about culture, and how we think about how culture is such a huge part of healing and definitions of health. And that's sort of, as a medical anthropologist, if I can get that across to my students or the wider public, then that I will feel like, we've done a good job. But thank you so much for your comment and your question. I would love to hear how you all are thinking about how you might have changed after this event, or after this sort of pandemic.
Hello.
Hello.
Hi, doctor. So just to answer your question right now, and then I kind of have a comment / question based on what you shared. I haven't changed anything. Obviously, like, there's certain things I can't do anymore, like I can't go to the gym, but I have not changed my day-to-day stuff that I have control over. And I find it, so that's to answer that question. And then I love what you were sharing about language, because I'm a believer that our words make our world. So like, I'm a Black male and I don't experience racism. It doesn't mean it doesn't exist, but I don't give it power. I don't talk about it. If something bad happens to me or I don't get an opportunity, I don't immediately jump to, it's because I'm Black, And what's interesting is, like, my parents talk more about that kind of stuff, and my mom has high blood pressure and my dad has diabetes. And as I'm listening to you, I'm like, oh, that makes sense, because I've heard like disease is dis-ease. So if mentally you're thinking there's like someone out to get you or a group out to get you, you're not going to be very relaxed, and you're going to basically put stress upon yourself, your mind, your body, and your spirit. So I just thank you for sharing that, because it's just reaffirms to me to continue to live my life the way I'm living it, but also sharing with people like the power of language and how it impacts everything that we do,
Yes, thank you so much. I think on your name it says
Yeah, you don't want
WK.
to try. You don't want to try to say that. So the first W silent. It's Quasi.
Kwesi, thank you so much, Kwesi, for your
Thank you.
comment. And absolutely, like I consider myself on the like sort of bridge point of the interpretive and the political economy perspective. Um, and so I absolutely have paid attention to the language because the way that we speak about things gives us sort of the conditions of possibility for actually the way that we talk about it gives us the conditions of possibility for thinking about things and thinking about our world. And so, yes, thank you so much for sharing your comment. Um, you know, for communities of color, um, we face sort of discrimination every day, and it's, you know, part of the coping mechanism is to, you know, not let it affect you, because if it affected you every single time, right, if you went to that place every single time, it would just increase your stress level, your cortisol level, which is not good. But what I did like about people who are studying this connection between stress and racism and stress is that, you know, it's about racism, right? It's about the treatment, the structural inequality, and it's not about the person, the individual themselves. So thank you so much for attending, and I'm glad that you enjoyed the talk.
You're welcome.
So Dr. Dow, one of the things that I thought was like compelling about the connection between racism and the impact that COVID is having on the African American community is also recognizing the folks that are protesting right now about the stay-at-home order, and they are predominantly white males that also are responding very violently. And so when you made that connection between the language being used as this war on COVID, and then like how like that has been incited, and then also like I can also kind of understand the like there's a lot of conspiracy theories, like is this real, is this actually a disease, and if you're not seeing it in your community, if you're not seeing it affect the folks around you, where you would have that belief that it's made up, you know, and you're going to protest to want these things, these opportunities back. So it's like, it was something that kind of made me get a little into that perspective, because to me, I'm like, what? Why are they doing this? And it's hard to like step into their shoes, but they honestly believe that's not affecting anything. And it's probably because they're not experiencing it personally. So thank you for sharing that.
Yeah, I would, so one of the kinds of, I think he's a medical sociologist, he named Jonathan Metzl. He wrote a book called Dying of Whiteness. I don't know if y'all heard of it, but he talks about how a lot of the ways that the political discourse has been really affecting and has been really affecting the perspective of white people and where they are in the racial hierarchy and all of these things, to the point where they're actually doing things that hurt them in the end as a group. And so again, this is why the interpretive perspective is so important, because like you said, maybe they're not experiencing some of the burdens, as you know, from the statistics that are being shown, they're not experiencing it, and so they don't think it's real. They're reading things online, speaking of language again, right? They're reading things online that are informing their own worldview, their own perspective, and so that allows them to go out there and protest. And you know, for us, it's like, what's going on? Because, you know, we have family members, we know people that this is affecting, we've lost family members. And so, you know, this is one area that probably needs more study.
I mean, and when you also think about like in the political spectrum, typically like this group of protesters, you know, they support the Republican Party, and the Republican Party supports Second Amendment rights, the NRA. And so you see them being very violent with their guns. So like using the language of potentially it becoming militantly enforced, it only exacerbates the need for them to want their guts to protect their amendment rights. So it's like, it's just really like,
I mean, fear does a number on people, right? And so, yes, I think that, your understanding of what's going on is really, really spot on. I think a lot of people said that, or in the news, I don't know if this has been researched thoroughly, but I think that there's like an overlap between the groups who are protesting and also anti-vaxxers. So, it's this, yeah. So absolutely, I think that there's like a cultural pattern here that's going on, that's linked to our political discourse and linked to our economic discourse.
I'm just wondering if you have any like advice for our students on how to talk about like even the language that we're using around COVID-19, like that could be empowering for them to utilize, or at least to be aware of in trying to navigate the world that we live in.
So I've been really, I've been just, for better or for worse, I have been on Twitter like every day, just reading everyone's hot take on things. And anthropologists and social scientists have really been pushing for more research about what's going on socially, because we're finding out more and more that this is not just a biological issue, right? Yes, it's a virus, but it's a huge social issue. And so one of the things that I have liked seeing coming out of social sciences and in anthropology is anthropologists who are writing about how this is a moment where we should be using the language of care rather than the language of war to talk about what's going on, to focus on how we're supporting one another, how we're caring for one another, how are we, so I like the way that the mutual aid groups say, like, this is about solidarity. This is not about charity. It's about, reciprocity and helping one another out, and, helping the elderly, putting in, efforts to do that as part of like just building a more caring society. So I really like that kind of language, and I'm happy to share the links that I have for people who have written about that. So
it just also makes me think about Facebook too. Like Facebook added a new emotion or reaction, and it's like the emoji holding a heart to mean like with care or with love. So I'm like, okay. Even being able to see that reflected a little bit in the ways that we can socialize now.
Oh, wow. So our emoticon language is actually also evolving with this.
Yeah.
So that's really interesting. I didn't know about that.
So I know we had some students here. Do you all have questions for Dr. Dow? Feel free to just ask or to put them in the chat so I can ask for you.
Or even just any comments about, what do you want to see coming out of this that you've, engaged with? And
yeah, one thing I wanted to thank you for pointing out is the like Malthusian perspective on like this is Mother Earth's way of curing herself, especially because there's a lot of statistics and like research being done on like the lack of air pollution and things like that, like especially over LA, but it still doesn't get to the fact that like I was actually in a community panel last like a couple weeks ago with for Earth Day, and they were talking about that that relationship shows that we can't have an ethical relationship with the environment, and like we can't celebrate air pollution because it's not that we're not that we have healthier practices. It's just that we're not engaging with the environment in the way that we normally do. So it doesn't really say anything in regards to our efforts in environmentalism. And so it's interesting that there's a lot of like eco-fascist like rhetoric, regarding, population control and things like that, again, like cleansing the earth, and it's very, it's racist too. Because again, these things are affecting, minority populations much more disproportionately than white populations. And so I did want to thank you for pointing that out in your presentation, which was very good to point out, because again, that's a lot of rhetoric, especially like it's cloaked in environmentalism, because again, that's a big push right now in the climate change community is like, okay, like look at like the earth is healing kind of thing. And it's like, but at what cost, and so that's something that needs to be talked about more. But yeah, and I think in terms of post COVID-19, I think one thing we're seeing is like, which is a good reaction, is like people realizing that we need more like of a local dependency upon like for food and different things like that, that this dependency on like international and global exchange is flawed, and so there's like, I know I've been seeing a lot of push for like people growing in their own homes, growing food and things like that. And so I think seeing more community gardens, different things like that, more local food systems and like local care systems, like, making sure that, we have like community clinics and different things like that, that are, where the medical caregivers are understanding of like the community concerns and community issues. And so I think that's something I want to see more, because again, all those things are tied together, and it'll be much better for us, as we localize everything. And yeah, I hope that's what we see.
Yeah, and gosh, like how nice would it be to have all those things like adequately or well funded, right, by our state or local governments and all of that. I mean, that would be really amazing, and a different way of doing things that could be much better for a lot of people.
Well, I really hope that people have filled out their 2020 census, knowing just how our structures are in place, because I do worry about that folks aren't filling that out, and then we're going to have 10 years, impacted by this like event.
Maria,
so that's
do you
my
know?
Shameless plug. Fill out the census.
I was just gonna say, do you know when that's when the last day that is to do that?
I'm not sure. Let me look it up right now.
Because we can add that maybe to the link for this talk.
Yeah, I know it got extended because of everything going on, so like people have time, and you can register online as well, I think, so.
Yeah, I think it's pretty easy now, right? My partner did it, and he just did it online, and I think it took like 10 minutes or less, and it's so important.
Well, I know it's not too late, it says, but it doesn't give me the deadline here. It's not giving me a deadline, but you can do it now.
So we'll put a link.
Perfect.
Yeah.
Any other questions or comments for Dr. Dow? All right, I'm not seeing any coming in, but I want to thank you so much for your wonderful presentation. I know I learned a lot about anthropology that I didn't know. Bones, I love that show.
Yeah, I was like, what's the shortcut way of getting people to know what these different disciplines are?
It's so funny because I'm like, oh yeah, that's what an anthropologist is. But then when you were talking about all the different ways, I'm like, okay, anthropology is huge. There's so many different perspectives. So I thought that was really neat, especially the red pill, blue pill, because I've been reading a book that is referencing the Matrix a lot. So I'm like, so really, really neat stuff. And I appreciate your time. I'm so thankful that you're our faculty in residence and that we have you for more time. So I'm sure there may be future events to come from this. And I'll make sure to put in the post your Twitter information. So make sure that you all follow her on Twitter if you'd like to learn more.
Thank you so much, everyone. I know it's week 15, so I appreciate you all being here.
Awesome. Thank you. Have a wonderful day, y'all.
Bye. Thank you.